Friend, since you're sharing your screen, you're going to see the globe at the top bar, or you can stop sharing and then you will see it at the bottom.
So it looks like you should be able to get started unless I'm missing something here.
So so you haven't started interpretation yet. Did you click the globe and put my name and then hit start?
Yes. So it's not giving me the option to hit start.
Okay, do you mind passing me host real quick?
Sure thing. Thanks all for bearing with us while we figure this out.
Ok, I'm starting interpretation now. Voy a empezar la interpretación.
All right, so here is just a brief overview of today's session. So we just did our welcome and interpretation overview. I'm going to pass it to Leticia for an overview of federal grant requirements and reporting. And then we're going to walk through the behavioral health services and supports application. So this will include how to apply on eCivis, which is the grant application platform, review the county goals and funding priority categories, and then provide some examples of services for each funding priority category, and go through some frequently asked questions and give a little space for y'all to ask questions at the very end. So now I'm going to pass it over to Leticia.
Hello, everyone. So I'm Leticia, as she stated, and I'll be going over the requirements for the federal grants. So factors in determining expenses order of precedence. So the 2 CFR 200, they have the allowability of costs, reasonable costs, acceptable costs, and then cost principles. And then the final rule meets the primary goal of the coronavirus state and local physical recovery funds. And then the agreement, which is the Adams County requirements, it's fulfilled and then signed by the subrecipients, and it's the agreement you'll need to follow. Allowable expenses per the UG 200.403 to be allowable, a cost must be necessary and reasonable for the performance of the federal awards, confirmed to any. Sorry, I'm moving. I didn't realize my little screen was going to be in my way. I apologize. To any limitations or exclusions set forth in the federal award as to cost items, be consistent with policy and procedures for non-federal expenses, follow generally accepted accounting principles, the GAAP, not to be used to meet cost sharing or matching of another federal award, be adequately documented and accrued within the approved budget period. So costs not specifically prohibited by federal regulations or the specific grant contract. To be reasonable, a cost must be ordinary and necessary for operations or efficient performance of a federal award, follow sound business and best practices, federal terms and regulations, follow market price for comparable goods and services for geographic area, administered with precedence with regards to responsibilities, doesn't significantly deviate from practices and policies regarding incurrence of costs. So costs that reflect what a permanent person would pay. Unallowable expenses per uniform guidelines are alcoholic beverages, contributions or donations, fines and penalties, interests, lobbying, pre-award costs, and then per the SLRF, the SLFRF, April 2022 compliance supplement, which is the guidelines you'll want to follow by, and you'll receive it. You'll receive a copy of that when agreements are sent out. Is debt services or replenishing finance reserve for like rainy day funds. That's satisfactions of settlements, any program services or capital expenses that undermines the efforts to stop the spread of COVID-19. So overview of what expenditure categories is. So per the U.S. Treasury compliance and reporting guidelines, all expenditures must be reported under one of the following categories. So the EC, and so everybody, there's a list. So EC1 supports public health expenditures. EC2 addresses negative economic impacts to households, small businesses, nonprofits, industries. EC3 addresses public health, negative impact, economic impact, public sector capacity. Each program and organization will go through this list to decide what best expense category fits your particular program. Not everybody will be the same. Each expense category does have certain requirements as far as reporting goes. And so this is just a list of a few of the different categories that are recognized by the U.S. Treasury. If you could go to the next page, it's also so these are necessary to allow the Treasury to conduct oversight as well as understanding and the program's outcomes across our recipients. So evidence-based is our recipients must identify the amount of the total funds allocated to evidence-based interventions. So what is evidence-based? For the purpose of the SLRF, with the exception of investments in educational services, evidence-based refers to interventions with strong or moderate evidence as defined below. So mandatory performance indicators and programmatic data where relevant. So public health and negative economic impact is collection began in April of 2022. Brief description of the structure and objectives of assistance programs, including public health and negative impact, economic impact experienced. Brief description of how a recipient response is related and reasonably proportional to a public health or negative impact, economic impact of COVID-19. So here, if you have not collected the data, you would provide examples or language as to possibly if somebody else, a different organization, has gotten results and have seen an impact by doing what it is that you're looking at doing. Evidence-based is just really for the Treasury to see what impact your program will have to the community using these funds. So the final rule, key principles: respond to pandemic needs and support families and businesses struggling with health and economic impacts. Maintain vital public services amidst declines in revenue. Build a strong, resilient, and equitable recovery by making investments that support long-term growth and opportunity. Caveat, refer to your agreement for use of funds, performance dates and milestones. Programs designed to reduce the impact should be related and reasonably proportioned to the harm identified and reasonably designed to benefit those impacted for eligible use only. Equity considerations: SLRF funds are tied to serving underserved and disproportionately impacted communities and businesses affected by the pandemic. Each month, each subrecipient is responsible for grant reporting. One of those grant reporting is the financial monthly report, which is to be submitted on the 15th of each month. With that report, you do need to submit supporting documents, and those include proof of payment and purchases such as invoices, pay stubs, billing statements with dates of service, itemized receipts, bank statements showing the clearance of the invoices, copies of checks, so of cleared checks, and in credit card statements. Also, another report that is required and has to be submitted is the quarterly report. The subrecipient will submit a progress report each quarter. The report includes milestones, accomplishments, and significant events or activities that occurred during the reporting quarter. So quarter one is the period, it covers the period January 1st through March 31st, and the due date of that quarterly report is April 15th. Quarter two is April 1st through June 30th, and with the report due on July 15th. Quarter three is July 1st through September 30th, and the report due October 15th. And then quarter four is October 1st through December 31st, and that quarterly report would be due on January 15th. Additional reporting requirements required for all expenditure categories is project description, description of the program structure and objectives, including public health or behavioral health impact experienced, description of relation to COVID-19, populations of focus. The subrecipients must report on whether projects currently serve or intends to serve populations of focus as outlined in the behavioral health services and supports assessments, a blueprint for action, capital expenditures, program income earned and expended to cover eligible project costs. So section 3, I'm going to go over how to apply for the behavioral health services and supports application. So the link above, that is the eService link. That's how you will access the application. You will select solicitation, and down at the bottom of the screen, you'll see behavioral health services and supports, and it'll show the application start date, which is June. It shows June 17th. And then you would click the hyperlink. Once you click the hyperlink, you would select apply, which is right there at the top left corner. Once you hit apply, you will create an account. Something to keep in mind is when creating this account, you will want to make sure that the account you're using to create an eService is the account you will use to once you apply. Because they will not speak to each other if the emails do not match. So once you put in an email and a password and hit sign up to create that account, you'll get an email, and you'll want to just verify your email. Then once you this is the email you'll see in your inbox. You will confirm your account, and then you will want to log back into your portal. So once you confirm, it'll take you to the login, and you'll be able to log in. So then you will hit hit the select apply, and then go to files. You'll log in with your credentials once more. And so that's what that login looks like. So completing your profile, as I stated earlier, you'll want to make sure that the email you use to create your portal account must be used as your email in your profile. So you will want to make sure those two emails match, or else they will not speak to each other, as I stated a little earlier ago. Then you will click open at the bottom to begin, and then return to save the edits. Then on the left side of your screen, you'll see these three options, and you'll want to select my profile, and then edit application information and the organization information. So completing the application, you'll then hit application process. And then you'll hit open there, and then once you'll be able to hit open, and then you'll get a pop-up to either save your draft or mark as complete. So you'll hit open, and then it will send you to the next screen. This is where you will be able to upload your documents, such as the budget template, the risk assessment, and you'll want to label them risk assessment and budget to be able, and this is where you'll upload them here. So once you have completed your application, you will see where it says complete. If you saved or completed this step, you can click edit to make changes before submitting. Once you have submitted, you will be able to view but not make any changes any longer. So before hitting submit, you will want to, just double check that application again, because you will not be able to go back and make changes once you hit submit. You will then see, once you hit submit, you'll see a green box pop up at the right corner, and it will say this has been submitted. And then as you see, you will then only be able to see a view box, so you could view your application. You can check the update of your application, and it will say, such as this one under review. and it'll tell you when it was created, and then your project title.
Awesome, thank you so much. So now I'm going to go over some of the behavioral health services and supports guidelines for this application. So earlier this year, our wonderful team completed a behavioral health assessment of Adams County to evaluate the services and supports and gaps that are currently present at the community level. And out of that assessment came a number of recommendations. So the recommendations are really what we're basing these applications on. These recommendations came to light because of gaps that were noticed in the services and supports that are available in Adams County. So the recommendations are tailored to meet some of those gaps, fill the needs that we are seeing at the community level. So I'm not going to read all of these to you. These will be posted online for you to reference back to. So the overarching theme for this first recommendation is to expand the behavioral health workforce in Adams County. So you might notice that's pretty broad. We have a number of sub-bullets here on things that our team found are particularly salient within Adams County. So ways to meet some of these needs and fill some of the gaps in the behavioral health workforce in Adams County. Our recommendation B is to increase universal screening, referral, and integrative care for behavioral health within all critical settings, including schools, primary care, and specialty services. So again, some sub-bullets here. We notice a lot of gaps within the services and supports that are provided at the school level. So that is a huge area of focus for this notice of funding opportunity. And then we have recommendation C to improve and increase care coordination and case management among providers, systems, and across jurisdictions. So again, these are the areas around which we're kind of grounding the gaps that we're wanting to orient to in this behavioral health services and supports notice of funding opportunity. And then down here, we have an example impact statement. So these can be tailored program to program, proposal to proposal, but we want to see an impact statement that kind of explains what you as a program are wanting to propose to support with this funding. So this slide here has a couple of funding priority examples. So we have them broken down into categories. Again, don't have to be super prescriptive with these. We just wanted to provide you all with an example of funding categories and what might fall into some of these categories. So proposals for funding can include things like direct services, so direct costs for behavioral health services, direct costs for behavioral health supports, temporary services and treatments for behavioral health crises, among other things. This funding can also be used for staff supports, so case management, personnel, internship, overtime costs. We know that the system is pretty overburdened, so we want to be able to support all sorts of behavioral health services and supports at that level. We also have program costs, so this could be data collection tools, program supports, costs associated with administering screenings, etc. And then finally, we have the building capacity category. So this could be trainings or certifications, technical assistance, language training, translation or interpretation services. And again, things don't have to fall exactly into these categories. We just wanted to provide some examples of what these sorts of proposals might look like. So we have this slide and the next slide are scoring criteria, just to kind of be transparent and give you all an idea of what we're going to be looking for when reading these applications. I'm not going to read all of these to you. I'm just going to kind of go over the broad categories, but this information will all be available online if you want to reference back to it. So we're going to be looking at a problem statement, kind of seeing what your interpretation of the problem that you are aiming to support is, your project overview and the impact you're choosing to or hoping to have, the capacity and sustainability of this proposal and your program. We'd love to get into some equity considerations, so your populations of focus, and then efforts to support culturally and linguistically congruent care. The actual implementation of the project, so this includes key drivers, key performance indicators, and timelines. And then finally, a budget. So what are you hoping to spend money on? We have a template for this that includes some examples if you need some help. And then our grants team is always available to answer questions. Here we have submission and notification timeline. So as you can see, the application opened about a week ago and is open through July 29th. So midnight on the 29th is the last day that applications will be accepted. Today, that June 25th, is our virtual information session. And then we're hoping to have all proposals scored by August 13th and award decision notifications the week of August 26th. So once you apply and we reach out to you to say whether we accepted or whether we are offering you an award, you'll have between 7 and 10 days to decide whether you want to accept that award. After that point, we have a Board of County Commissioners approval and award ceremony, and then we're hoping for a kickoff meeting with grantees the week of October 14th. That last deadline you see there is a deadline that you have to expend all of the funds we offer you. So December 31st of 2026, those are the federal ARPA guidelines. So that is the absolute day during which funds can be spent. Now we have some frequently asked questions. So there are 3 slides of this. I'll go over them and then we'll open it up to see if y'all have any questions. I know a couple have popped up in the chat, so we'll get to all of those and then we'll make a note so we can send all this information out to folks after the fact. So as Leticia mentioned before, this is a federal grant, so all grantees must follow 2 CFR Part 200 for these administration requirements, cost principles, and audit requirements for federal awards to non-federal entities. To enter into an agreement with the county, your organization must have an active registration on sam.gov. And then one thing we think is pretty important to note, so we're not offering reimbursements for this. We can make 1 or 3 payments over the course of each year. We also will recognize indirect costs, so facilities and administrative costs. We do 10% fringe cost or the federally negotiated rate that your organization may have. As mentioned before, the grant management system that we are using is eCivis. We're going to make this recording here available and the slides available after the presentation. These are a really great resource because the platforms can be a little bit tricky. So this is a great resource to go back if you have any questions. And again, the grants team is always happy to answer anything that may come up for you. And then finally for this, the grant period will be through December 31st of 2026. If you have a shorter term project proposal, it does not have to be that full amount of time. You can propose a year-long project, but the absolute last day that funds can be used is December 31st of 2026. If you apply, for example, for a 2-year project, you do not have to reapply for funds. You'll be considered funded for that entire period. So if you had questions, is evaluation required? So we are going to ask you with the application to develop a set of key performance indicators that will be measured throughout the grant cycle to track proposal outcomes. We have a couple of wonder folks here from the Rocky Mountain Partnership. They're going to be available to you all at the beginning before the grants are due to provide some technical assistance if you want support developing key performance indicators, and then kind of figuring out what mechanisms might be best to track your outcomes of interest. So we have, would providing facility upgrades or purchasing program supplies be allowable given funding restrictions? Yes, absolutely. Just make sure that you indicate that in your budget. This presentation is being offered in Spanish and English, so some folks may be wondering whether the application will be available in both languages. Unfortunately, the application will only be available in English. We're working on being able to provide applications in Spanish and English for future funding opportunities, but unfortunately, we're not able to offer that for this particular notice of funding. For folks wondering whether funds can be used for FTEs, yes, this should also be indicated in your budget. And then we've had some questions about whether you can apply if your organization or the services you provide are located outside of Adams County. So the answer to this is yes as well, but the expenses for the grant must serve Adams County residents. So the example we have down there, I think, is a helpful one. So if 30% of your staff time is allocated to providing services and supports for Adams County residents, then you can ask for up to 30% of the cost for that FTE. In the application, we have a note that we will be expecting grantees to participate in community learning and/or technical assistance calls. So our desire for commitment right now is to have folks attend at least 4 of 6 calls over the course of a calendar year. This will be held every other month for 1.5 hours. We might do some tweaking to the cadence. We'd love feedback from grantees. So there could be a change to this, but we don't anticipate it being a ton more commitment than that. We also might have some questions about whether projects have to be fully sustainable by the end of the grant term to be considered for funding. This is not the case. Funding is not going to be based on your answer to this question or your organization's capacity to be fully sustainable by the end of the grant term. We're really just wanting to learn more about your organization's plans for long-term funding and your eye towards sustainability in the future. Folks might be wondering whether we can explain how proposals will be weighted based on the recommendations they address. So organizations that select one recommendation from that list I went over earlier and clearly explain how their proposal addresses that selected recommendation will receive the full 10 points for that answer. You'll be given an extra 5 points for each additional recommendation addressed by the proposal. And then finally, is assistance available to support the creation of key drivers or key performance indicators? As I mentioned before, Rocky Mountain Partnership will be available to provide technical assistance with key drivers and associated templates. So you can reach out for me, or we have some contact information for our Rocky Mountain Partnership partners that we can share after this session if that is a support that you all would be interested in. All right, any questions from folks? Ty, I see you have your hand raised.
I was hovering the hand raising button. So my name is Ty Smith, and I work at Atlantis Community. We're a center for independent living. We help people with disabilities help themselves, somewhat like a caseworker. We also provide community trainings, and I'm wondering if like peer organizations where people with disabilities themselves can apply for this funding, or if it's strictly for clinical and written in. I think I saw somewhere that you have to have like defined definition of what organizations can apply. So that's my question.
So I'm sorry, just to reiterate, is your question whether specific individuals that might be part of your organization can apply? Is that the question? Or whether it has to be an entire entity?
We provide a lot of these services as a peer organization. And when I say peer, I mean like person with a disability. I am the independent living mental health specialist. And I know that there's a lot of peer programming out there. Colorado's kind of leading the front when it comes to peer delivered systems. So I'm just wondering if these services can be provided by a peer, or are they written in statute or written in, not statute, but written out, defined on what sort of entities can apply for these services?
Thank you so much for that clarification, and thank you for this question. I see Emma, you popped up. Do you have anything you want to share about this, or just?
Sure, I'd love to answer. So Ty, peer services are one of the areas that we identified in our assessment as an area of potential need and support. So it was identified as a gap and is included in our recommendations to both expand the behavioral health workforce in Adams County and to increase access to services. So peer supports would be considered services under this grant as it relates to our recommendations in the assessment. And if you want to take a look, we'll drop the link to the assessment, but our recommendations section starts on page 52 of the assessment, and you can kind of read through each of those sub findings, but peer supports are included in there.
Thank you so much, Emma. And just to expand on that a tiny bit, so correct, these do not have to be clinically based services. We're really wanting to expand all types of services and supports that have to do with behavioral health at the county and community level. Before we go any further, I just want to provide a reminder to folks, since we're doing question and answer, that we have interpretation happening. So just make sure that you've selected the language that you're wanting to hear these questions in.
And just to answer a couple questions out loud that were in the chat box. Anthony had asked, does the reporting expenditure have to cover all the items on the list, or can it be some of the items? I did reply to that and said each organization will be able to select the one that applies to you. So your organization, you would select the one that applies to your organization, and not one organization will use all of the expenditure categories. So I hope that answers your question, Anthony.
It does. Thank you.
Perfect. And another question here that I know was directed to that I could assist with is, Lisa, will there be a contract budget amendment process between the grant years? Absolutely. Once, if you are granted the grant and an agreement is put in place, if after a year and a half, like 6 months into it, you realize that you need to make an adjustment to that budget, then a budget amendment can be completed. And then just another question, I don't know if you could answer it, Fran. It says, Ty asked about the peer support. When would funding begin? At the date of the award ceremony or during the grantee kickoff meeting?
Hi, everyone. This is Emma again. The grant would begin at the time of your contract execution. It is our goal to have all contracts executed by the grantee kickoff meeting, but we'll need to do those final contract signing and execution processes individually with each awardee. So again, our goal would be to have it start by that kickoff meeting, but we may need to take that when contracted.
Just to reiterate that, because Emma, your sound was breaking up a tiny bit. So sorry about that. So yes, we are hoping to have all of the contracts executed by that kickoff meeting. It does occasionally take a little bit of time. So we're hoping that we can get folks in executed contracts by then. That would certainly be the goal. Peggy has asked whether we can share a recording. So after this wraps up, we'll share the recording to this information session along with these PowerPoint slides in both English and Spanish. And then a lot of the documentation we've mentioned, so the assessment that Emma shared, the scoring criteria, these can all be found on that solicitation page. Along with the budget template, we have a template for those key driver indicator or key performance indicators. That's all on that final files tab in the solicitation page on the website. See, Allison asks whether there is a minimum and maximum award amount. So the minimum amount we have set out is $10,000 and the maximum we have is $500,000. This information is also available on that solicitation page if you want to refer back to it. And then Zoe, I see your question about location for services being considered. So the location itself, I would say not necessarily. The organization that is applying does have to serve Adams County residents. Oh, okay, sorry, I'm catching up in the chat. The organization does have to serve Adams County residents, but that doesn't have to be where the primary services are located, or doesn't have to be only Adams County residents that are served. So for example, if you have 2 clinicians who spend 30% of their time working with Adams County and 30% working with Broomfield and 40% working with Jefferson, the funding proposal that is put forward can be up to 30% of the FTE of those clinicians. Does that make sense? Awesome. Any other questions from folks? Sure, Ty. So either myself or typically Carla, she is out sick today. Emma, do you have anything else to add?
No, can you hear me okay? I just dialed in on my phone.
I think so.
Okay, all right. No, I don't have anything else to add. I just wanted to double check and make sure that we answered everyone's questions. But please let us know if you have additional questions. And again, we'll make sure you have all of the information available on our website. We can also follow up with email, and we'll make sure that you get the information from the Rocky Mountain partners around the key drivers support as well. I do see, Ty, you have a question here about just connecting with us about FIT. And yeah, I think if you want to reach out to Fran, she's going to share her address, and we'd be happy to chat with you more on that.
Anything else for folks right now? Awesome. So I'm going to pop really quickly my email address into the chat, as well as Carla's. So if you have more specific questions, kind of like the ones that Ty mentioned about the application, about organization fit, about funding goals and recommendations and priorities, please reach out to me. If you have more specific questions about eCivis as a platform, about any of these specific like nitty-gritty federal grant related details, please reach out to Carla. And then I will provide a link for you all to Rocky Mountain Partnership. Ben, I don't know if you're still on here, if you want to say hi really quickly, but I'll share contact info for Ben as well, and he can help you all out with some of those key drivers, key performance indicators.
I am still on here, and hello everybody. Thanks for the quick intro. Yeah, like they were saying, we're here with any support necessary along the way, help you guys come up with some solid KPIs and goals as well. And we'll make sure that contact info gets out to you guys so that you can sign up for those sessions. Thank you.
Thank you so much, Ben. All right, all. Well, I will let you all go. If you have any questions that come up, please reach out to me. If you have questions about any of the documentation, that solicitation page is a really good first place to start. But yeah, please feel free to reach out with any questions, comments, or concerns. Thank you all so much for being here.